This video is about how to use a massage gun for Achilles tendonitis. Now, we're first going to look at what it can do for you and when it actually isn't that useful for Achilles tendonitis, and also when it can actually make it worse. Then we'll look at general contraindications. When is it safe to use it, how to safely use it, and what to avoid. And then lastly, I will explain to you what the best settings is and what areas you want to focus on if you have Achilles tendonitis. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment of your Achilles injuries. Have a look at the description of this video if you want a link to our website. Does a massage gun actually help Achilles tendonitis heal more quickly or better? Well, the answer to this is yes and no. It doesn't actually help strengthen the tendon. So for the tendon to strengthen and heal and recover, you need a mix of relative rest, so taking away the things that aggravate it so it can have time to recover, plus slow strengthening. And we've made a whole video about best treatments for Achilles tendonitis. However, so massage, whether you use a massage gun or regular massage, it can't strengthen your tendon and it can't change the structure of the tendon to a healthy one again. That's just not possible through massage. But what massage can do is it can help decrease your pain. Now, the pain dulling effect of massage is short-lived, but it is really useful because if you have Achilles tendonitis, it may interfere with your sleep, the pain may interfere with what activities you can do, and it may even stop you from doing your rehab. So using a massage gun can help decrease that pain and help you actually get on with the rehab and the things that you need to be doing to get your tendon better. Now, you don't have to use a massage gun. You can also use your own hands or use a foam roller. And I've made a detailed video about how to do that. So have a look at the description of this video. I'll put a link to the other massage videos in here because each of them have do's and don'ts for how to do it. So to recap, it's not going to make it heal more quickly in the sense that it changes the tendon structure, but it can be useful because it decreases your pain, help you get on with things and just be more comfortable throughout the day. Okay, so how to use a massage gun safely. Now, let's first look at general contraindications. Why am I bothering to give you these if it's all about your Achilles? Well, because if you have a massage gun, you're very likely to use it on other parts of the body as well. And you can actually do yourself some serious damage and injury if you don't use it in the right way. So let's quickly run through these and then we'll get to the Achilles. First thing is, if you have any chronic condition like diabetes, kidney disease, or even just low iron, anything that can affect how well your body heals and can affect cell health, you need to be really careful with massage guns. Short treatments, light percussions, but it may also be worth actually just avoiding it and going for general massage rather, because there is reports in the research that people with these conditions have gotten excessive damage from massage guns and it's actually really influenced their health. Then you definitely want to avoid any areas where arteries and nerves are exposed. The neck is a no-go, nothing above this level, and not on the face either. Also, arteries in this level, you've got arteries under the arms, in the groins, behind the knees, around the ankle. So anywhere where you don't have a lot of muscle is not safe to go because there's been reports of damaged arteries to the brain from using it on the neck, actually causing strokes and death. There's been reports of people damaging arteries in this area, causing blood clots and again strokes. So please, please, please stay away from main arteries in these exposed areas. Then when it comes to the face, there are reports of people using it because of headaches and they've actually injured their eyes. So it didn't go on the eye, it's just the vibration that was carried to it caused the retinas to loosen. And they also reckon that it can be dangerous if you do it around your ears. So it's really best to avoid all the way up. You do not want to do it over open wounds or rashes or any areas of active inflammation because you can make all of that worse. If you have a new scar, so any scar younger than 12 weeks old, and this, you may be using this if you have an Achilles tendon tear, you may be thinking you've been after surgery, oh, can I use a massage gun? Do not use it on the scar until that scar has properly matured and your surgeon has said it's okay, because you can actually damage the scar tissue as well and cause extra scarring to happen. over the chest area. Now, normally, if you have quite a lot of muscle, like big pec muscles, big back muscles, using it over the chest is okay. If you do not have a lot of muscle there, you may want to think twice about it. Also, if you have a chronic lung condition like chronic asthma or chronic emphysema, then be careful, because there are reports that using a massage gun under those circumstances can actually cause damage to the pleura, which is the sac that covers the lungs, and that can cause quite serious injury. So it's best to avoid those areas if you fall into those categories. Okay, so how can you use it safely for your Achilles? Well, the first thing is, if you have Achilles tendonitis, you are not actually going to go on the tendon to start with, because when a tendon is injured, it is really easy to irritate it, and especially compressing it. And it's a bit like pressing on a bruise. It just really can annoy it. So it may feel good while you're doing it, but then several hours later, it can cause your pain to increase. And this is especially true for people who have insertional Achilles tendonitis, because their compression is part of the reason why it gets injured often. So definitely, if you have insertional Achilles tendonitis, I tend to tell my patients not to do it over that part. If you have a bursitis in combination with your Achilles tendonitis, then it's definitely a no-go. Do not go and do that, because it will just irritate the bursa further. What we're going to do instead is we're going to focus it on the calf muscles. Now, the calf muscles are made up of your gastrocnemius and your soleus muscles. And they usually get trigger points in them, and it can become really tight and uncomfortable when you have an injury to your Achilles tendon. So we're going to focus on them, but you also want to take note that your main arteries and veins and nerves in your leg runs right behind your knee and down the middle of your calf. So we're just going to be careful of that area and not go really hard over it. If you ever feel any tingling or funny sensations while you're using the gun, it means you're irritating a nerve. Come off it. Don't do it as hard, because it will just cause you discomfort and more pain later on. Now, while we're on the subject of pain and discomfort, there's a tendency when you're injured that it's satisfying to make something hurt. So you can really get it and grind it and feel as if it should be doing it good. But actually that's not the case. What happens is some discomfort, so some pressure, up to about a 6 out of 10, is really useful to calm pain down. But anything above that, if it's really painful or it feels really, really uncomfortable, it can often make pain worse. And this is why sometimes a massage can be brilliant at calming your pain down, and other times it can actually make it feel a lot worse when somebody goes in too hard. And it doesn't necessarily mean that they've damaged you. It may just mean that actually they've kicked off the pain signals more, and now you've got the opposite effect. So if you're doing this for Achilles tendonitis, stick to a discomfort level of 6 out of 10 or lower to get a best pain dulling effect. Then if we look at the research, what it shows is, depending on the frequency you use with your gun, you want to use different durations to get the best muscle relaxation, flexibility, and pain dulling effects. So what are these? If you're using a high frequency, that's seen as anything above 2,400 percussions per minute, then you want to stick to treatments of 2 minutes or shorter per muscle group. So this means 2 minutes for the gastroc, inner and outer part, and 2 minutes for the soleus, inner and outer part. So 4 minutes max per calf muscle. If you're using a lower frequency, so 2,400 percussions or fewer per minute, then you can do longer treatments. So then at least 2 minutes, but maximum 5 minutes. What I will also say here is, use your common sense. If you're somebody with quite large calves with a lot of muscle, you will likely benefit from the higher end of that range. Whereas if you're somebody with tiny calves and you don't have that much muscle, I would go with less time first and less intense percussions and see how that reacts, and maybe build it up slowly and just check how it goes. So go according to your body size as well. The best fitting to use, according to the research, for muscle relaxation is if you use the ball one. So the one that's kind of the size of a golf ball. You don't want to use those thin, pointy ones, because they can cause too much discomfort and actually have the opposite effect on the muscles. How do you apply this? Well, to be honest, there's no gold standard to this. You can either move it around slowly, you can stay on one place for a bit, just not the full 2 minutes on one place. You have to move around the body, the muscle part, but you can't go wrong as long as you keep it within the limit, not too heavy percussion, and you don't push too hard with it. Then importantly, you do not want to do this too often because your body has to respond to the massage and recover. And just like with normal massage, you do get some muscle damage from the percussions as well. So it's best to only do it every second day or leave at least 48 hours between treatments. Brilliant. Hope you found that useful. Now remember, if you need more help with an Achilles injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.